Hey, Dr. Cunningham, how are you today?
I am doing great. How are you, Michelle?
I am awesome, thank you. Thank you for taking this time to speak with me and my patients and other members of the public to kind of educate them about the amazing things that you guys are doing over there. I know you're a medical doctor. I know you focus on gut health and lowering inflammation and all of those amazing things that have really come to light recently in our society. And it's really important stuff for people to know and learn. And I know you're going to dive into that. Before you do, I want to make sure that our listeners know a little bit more about you. So you're a medical doctor. You own Great Health 365, which is such a cool name, by the way. That's why I picked All Seasons Chiropractic, because it's 365. It's all year round. I love that. Health year round. So tell us how you got here and what it was that made you want to deal with inflammation specifically.
Well, the short story is that I myself was diagnosed with an inflammatory condition. In my case, an autoimmune condition called Hashimoto's thyroiditis. And of course, when you're diagnosed with a condition like that, you want to read everything you can get your hands on, and which is what I did. But what really got my attention was when my knees started to hurt so bad I had to basically give up running. And I'd been a runner for 40 years, so that was a pretty big deal. And so I really began to dig in at that point. And fortunately, with the help of several clinicians, including Dr. Michelle, thank you.
My pleasure.
I was able to get back to running, and my knees are doing great now.
Awesome. And I'm so glad you got back to running, because I know that was really lighting you up and you just couldn't do it for a while there. That was a really big deal.
Yeah.
So I think it's cool that you dove in and you really took ownership of it and said, hey, let's figure this out, because you're going to run into patients who have these same things. So I imagine that's how you structured your practice, is to kind of look for those same cues and those same things that kind of triggered you to say, hey, I've got an autoimmune disease. I've got an inflammatory process going on here. We got to nip it in the butt. So that's awesome.
Yes, yes.
Very cool. Awesome. So a lot of patients struggle with kind of an ongoing pain kind of thing going on. And I'm just curious, as a medical doctor, so obviously chiropractor, I've got a whole different set of goggles than you to look at the world. So as a medical doctor, are there medications that actually really do a good job of treating pain?
I got to laugh. That's a great question, but I kind of got to laugh because as a medical doctor, I don't know whether people realize this or not. There's basically two groups of medications for something like chronic pain. The first group is, pretty safe overall, but not really that effective. Okay. The other group can be fairly effective, but so loaded with side effects, sometimes life-threatening side effects, certainly life-altering side effects, that, you kind of hate to use them. So that's kind of your choices.
Not great choices. You want effective or not effective? Dangerous? Right. Okay. Got it. Absolutely. Well, and that's what I'm finding too. In my patients that are on the lesser options, it's just not fixing the problem. It just doesn't, and as well as I do, it never actually fixes the problem. It just covers up the symptoms, which is great for lifestyle, not great for health. So are there quicker and safer solutions than the medications that are kind of proven to work clinically?
Yeah, absolutely. I mean, the good news is that I actually tell my patients that turns out that food is actually faster and definitely more effective. It's faster, literally faster, and in changing the problem. So I'll give you an example. A patient of mine came in about 6 months ago. When she walked in the practice, I can see it now. She walked like she had hot potatoes in her knees. And on exam, her joints were swollen. They had fluid all over the place, and she was not a happy camper. Nice gal, early 30s, but we put her on a focused strategic program, nutritional program, and a few targeted supplements, and within 2 weeks, she had 70% improvement. I mean, that
Nice. That's awesome. And that's natural. That's just something we have to do anyway. We have to eat anyway. So
yeah.
why not pick better foods and pick a better regimen to really take care of our bodies? That's awesome. That's so cool that you did that for her. That's huge, life-changing. That's amazing.
Absolutely.
What is the root cause usually for this kind of ongoing pain?
Well, the root, now, this is going to sound like a science fiction movie, okay? I'm just telling you,
I like science fiction.
okay. So it turns out that the real root cause of the inflammation is toxins that get embedded in our tissues, like pesticides, herbicides, heavy metals, etc. Because we live in a very, I hate to break it to you, a very toxic environment. Especially our food supply, air supply, water supply, and other places too. But it's actually not the toxins embedded in the tissues, which is obviously not good for your health in itself, but it's actually the response of your body's immune system that comes along trying to clean up the mess, that actually causes the actual pain. So it's actually the immune system's reaction to the toxins that causes the pain. Does that make sense?
Absolutely. So that would work the same with allergies, because the immune system is reacting to something that's unnecessary for it to react to. And that's what causes allergies, right?
Yes.
That's amazing. That's amazing. Okay. So what's the quickest way for, people to, get over this, get some traction on their life? And now we know what's causing it. What's the quickest way for us to get to that next place?
Right. Well, like I say, the first and quickest way is to dramatically change food choices.
Okay.
So with my patients, I talk about the big seven. Number one is pastured meats, poultry, and eggs.
Mm-hmm.
The second is wild caught smaller fish, like sardines, herring, mackerel, etc. The third is no grains.
Big surprise there.
And we can get into that more if you want to. But the fourth is no dairy. Okay.
Not even cheese?
Not even cheese.
Ah.
Again, I can get more into that. But fifth is a wide variety of preferably organic leafy and root vegetables.
Mm-hmm.
Sixth is no processed foods. And seven is actually fairly copious amounts of healthy fats and oils, believe it or not. So that's the quickest way to get traction and get it jump started.
That's awesome. So healthy fats and oils, coconut oil, avocado, those kinds of things in our diets.
Yeah.
Awesome. Awesome. And olive oil, of course, for cooking and stuff too. Awesome.
Yeah. Go ahead.
So kind of like I've heard, you walk around the outside edge of the grocery store and never go up and down those aisles, except to get your olive oil. But other than that, you don't go up and down those aisles, right? And that keeps you out of the bad stuff, keeps you out of the, on the side there. That's the bad stuff. Awesome. So how hard is it though? It sounds like that would be pretty difficult to change your whole everything, especially the no grains thing. We all love the grains, and if I can't have cheese on my potatoes, Dr. Cunningham, I don't know if I'd survive. So how hard is this to implement this strategy?
Well, okay, so I actually have my patients break it into steps, and I'll kind of go back here. But the first step is knowing that there is a solution, and a lot of people don't even know that there is a solution, right? I mean,
right.
One of my big goals is, even in doing a call like this, is to get the message out, because, if people don't know that there's a solution, it's like there's no decision to make. Does that make sense?
Absolutely. No question. Yeah.
I know I'm preaching to the choir here. But so in the second decision, or the second step, then, is to make a decision to follow those food choices no matter what they are.
Yep.
Okay, now that's a tough swallow. Okay. And then the third step is to find out, okay, well, what did I just decide to do?
Yeah.
Okay, so let me just give you a kind of an illustration of this. A patient of mine that was referred to me that I saw yesterday. This patient, 37-year-old, I think, a man, athletic, very, very motivated by the symptoms that he has. And he, and I talked to him on the phone, so I knew all this beforehand, but he said, I will do anything to get my health in better shape. And there is no price, and that's the level of engagement and motivation that a person needs to have success. And I'm trying to, sugarcoat this, but just can't, I mean, does that make sense?
Absolutely. You got to choose to do it or not. And if you do it, half-ass, so to speak, it's not going to be as effective as if you go all out. Now, can someone do some changes and get some change, or do you find in your practice that people need to continuously really stick with it? Because sometimes in our office, we'll find that if someone even just skips a day of their homework exercises, it makes a huge difference in their life. And so they kind of need to stick with it. So what do you find?
Well, you kind of just answered the question yourself. Now, I will say that, the better a person does with their, their sticking with the diet, whatever dietary plan, that we've come up with, the better they're going to do. Now, a couple of other dimensions that we see frequently is the more a person works on eating the right foods and even detoxifying those toxins, and we can talk about that later, but the more sensitive they become to the wrong foods.
Yeah, they do.
Oh, so you've seen that too. Interesting.
Always, every time.
So
Yep.
that tends to be, a way that patients can get better and better if they, if they harness it. But that means that you have to kind of deal with, what motivation is really there.
Well, and you can't ignore the signals. Our body will tell us exactly what it wants every single time. But we get so good at ignoring the signals. Oh, I have a little stomach ache. Oh, it's probably because I had a beer, whatever, or, oh, I'm a little tired today. And we just ignore it and we just write it off. But that's every single one of those is our body telling us, hey, what you just ate, no bueno. Let's go back to the drawing board and get that out of our diet. And I think so many people don't relate how they feel to their food, which is so bizarre to me because, how many of us have had one bite too many and we're miserable for like 3 hours because we ate one bite too many food, not to mention the wrong foods. But yeah, people need to pay attention to those signals. And then what you're teaching them is sustainable health, because you're teaching them how to listen to those signals so that when their body says, even if it's like a green pepper, and green peppers don't bother hardly anyone. Well, that might be you. You might not be able to eat a green pepper because that might not be a thing your body likes. If you listen to those signals, you can eliminate the green pepper and never again have migraines. What a cool thing, So I love that you're teaching people how to follow that and how to listen to that. That's so powerful. That is awesome. So I've heard a lot about this thing called leaky gut. Because there's a lot of talk about how it connects to the, it's the other brain, your gut's the other brain. And there's that whole thing about how you're, the biosis in your system and the little digestive enzymes and stuff are actually running your whole body. So tell me about leaky gut. Tell us about how do you know if you have it and what it is exactly.
Well, sure. I will say, as a medical doctor, we didn't hear about this in medical school. But in 2011, a physician, a medical doctor by the name of Alessio Fasano, brought this into the, kind of the conventional medical realm in the Journal of Immunology. And so he, the information that was in that article was that leaky gut, number one, is real, and he described it on a molecular level, on a structural level, and he also demonstrated that if if a patient has if you have autoimmune illness, that you have leaky gut, because leaky gut, you have to have leaky gut in order to develop autoimmunity. That was one of the things that he brought in that paper. So it turns out that leaky gut is actually probably the most common cause of inflammation.
Wow.
So, so if a person wants to know, well, do I have, leaky gut? Is it me?
Right.
And so if you have constipation, if you have, what we call spastic colon, irritable bowel syndrome, certainly if you have a known autoimmune diagnosis, or, including thyroid disease, or if you really, in my observation, if you have any chronic pain, you have leaky gut. And it's just a very common thing. Now we have testing available, for somebody that if they really want to know. There's ways to find out.
But it sounds like if you started treating it with, say, changes of diet and things like that, it wouldn't matter if you tested it and got the result, because you'd still feel better anyway.
Yeah, I agree with that. And I actually haven't tested well, I shouldn't say that. Testing is not necessarily a big part. Now, if I have an engineer and they're kind of skeptical,
right,
they got to see the numbers, or an accountant or whatever, I can treat anybody that walks in my door if they're motivated enough.
Absolutely, no question. Me too.
Right, exactly.
Yeah, if they do their homework, they'll be in. So is it treated the same way? I mean, is it ideally to change the diet and lower inflammation? Is that kind of what you were talking about with the 7 different foods that you add in? Is that kind of the leaky gut treatment?
That's the start of it.
Okay.
And that in most patients, that's going to be the lion's share of what it takes to treat leaky gut. And I'll give you a little bit of science behind that. Leaky gut. One of the causes of leaky gut can be if well, I don't want to get way too far into the weeds here, but let me say it this way: leaky gut, to a large extent, can be caused by the toxins in the diet, which shouldn't be too surprising, because if you're taking toxins in by mouth, what's that going to do to the very sensitive intestinal mechanisms and structure? It just stands to reason. So if you take the toxins away in the diet, that's going to go a long way.
Yeah, you start to heal theoretically.
Right.
Yeah.
Right.
Do you use aloe vera? Just a side question. Is that because I keep hearing about aloe vera to help with leaky gut? So you're the expert. I thought I'd ask.
I've never knowingly used aloe vera internally for leaky gut.
Okay, got it. I know it calms down, inflamed tissue, but so does not putting in toxins and all the things you were just talking about. So let's switch subjects just a little bit. Tell me about organic foods, because they cost more. I mean, not a ton more, but they do cost more. Is it really worth it? I hear things like, well, if it's a banana, it doesn't really matter because, the only thing organic does is keep pesticides off of it. So tell me about organic. Is it all cracked up to be? You did mention organic earlier. Certainly for the leafy greens, I get that that's important.
Right. Organic food is, you could say it's absolutely necessary for this process, and so if you basically can't really do this without organic foods.
And that's because of the pesticides and that. Right. Is it also because soil? Because I know our soil is so depleted, it's ridiculous. And things that are over farmed, you've got no more magnesium in any of your vegetables. And that's, of course, a super important ingredient in our bodies. So is it that too? Is it the nutrients of the food that's a problem? Or is it just mostly the toxins that are on the non-organic?
Well, I appreciate you bringing up the soil. And the soil is um, one of the reasons why, probably the big reason why not all organic foods are necessarily created equal. Okay, and the reason, and what I'm saying is that um, when Farmer Jones, over the years sprays pesticides on his crops, it gets into the soil too. It gets embedded into the soil, so that any plant that's planted in that soil is going to have toxins,
In it.
pesticides embedded in the
Mhm.
plant and in the fruit itself.
Yep.
So you can't wash that off, and so um, that's one reason, probably the biggest reason why not all organic produce certainly is created equal. Does that make sense?
Yeah. So how do you go about finding the good organic versus the not good? Like, do you pick the area of the world? Do we need to just move out of the United States altogether? Like, what do we need to do?
So,
Go to a small island in the middle of the Caribbean? Because I'm in. Let's go.
this is a really good question. And so since you asked it, I'll go ahead and I'll call them out. Okay. I'll give you two things. Okay. Two separate lines of discussion. Okay. So the first one is, if you really want cleanly sourced organic, vegetables and truly pasture raised, for the whole life, chicken, beef, pork, etc. The only place that I know of in Denver is Natural Grocers. Okay, and I don't have any financial stake in it, so
Right.
it's not that. But they're the only shop in town, and I can tell the difference when I pay a big price if I eat something that's not from there, and I'll just say that, and and maybe other people can get away with it. They're not as sensitive as I am. I have a very sensitive system. But now, the other line of discussion that I'll give you is one of my patients who's actually from out of the country. We got her started in her nutritional regimen. Then she went back to this. It's actually kind of a third world country, but they don't have pesticides there. Okay, and the meat that she ate, which she says tastes so much better in this foreign country, actually healed her system to a large extent. Now, we had also taken away lentils and some other things from her, so she was able to heal. So the right meats can be very healing. It's almost like the proteins pull the toxins out of people's tissue.
Wow, that's so powerful. That's amazing. I definitely need to move to the Caribbean. That's the thing. I'm sure, or somewhere.
There's your reason right there.
There's my reason. That's it. I'm out. Sorry, patients. I'm out. Can you guarantee that if someone changes their diet, that they're going to see changes in their chronic pain?
Well, that sounds like a loaded question, but it's a great question. So, of course, no guarantees in this business. But what I found that if a person is serious about this, anybody can get these kind of results. You just can. Now, sometimes you need some direction. I think that my situation, I'm a pretty informed consumer, I think you'd say, but I was kind of at a plateau, and because of that, I had to find my own seasoned integrative physician, and blew past my plateau, and I'm still blowing past it.
Yeah, well, we do need that.
Yeah. So
yeah. You need someone to guide you along the pathway and to give you support as you heal. Otherwise, we're going to fall off the wagon. That's why so many people get so far. Talk about weight loss. I have no doubt that if you reduce toxins in your body, because we know fat cells are basically just closets for toxins. Mm-hmm. So every time you get another toxin, your body doesn't know how to deal with it. It just stores in the closet. What do we do with all the crap we don't know how to deal with it? We stick it in a closet, and then all of our closets are full and we have to make more closets. Well, that's what fat cells are. So I know as you're in this process, people are losing weight, and people go on this nasty yo-yo there. I'm sure they do the same thing with pain. The pain will remind them and they'll ignore it. And then it gets worse and ignore it. And then there's a point and they're like, all right, that's it. Right. So, without a coach, which is what I would call you a health coach. I mean, I
do a lot of coaching.
Yeah, I was going to say, that's not to demean what you do. That's to elevate what you do. It's amazing to me that you take the time to listen to what they need and to help redirect them. You're kind of like the GPS of health. You're like, no, you got to turn right up ahead, stop turning left, and you get people to where they want to go. And if they get off track, you just redirect them. And I think that's really cool that you do that. I mean, that's super powerful. This is why I send people to you. I think you're amazing. So then the last question I have is, can you do it yourself? I get that we just talked about needing a coach and how important that is, but have you seen people successfully in your actual world do this yourself and not engage with someone else?
I have to some extent I've seen that. I had a patient that he came in. This is kind of the closest thing to a do-it-yourself that I've actually seen. And he came in. He said, is there something else that that I can do? And I said, well, you probably have inflammation. You probably ought to change your diet. Okay, well, I got to go. I have a meeting. And he scooted out the door. And then the next month he came in and he told me the story. After he left my office, he went down to the health food store, stood in the middle of the aisle, read the book, whatever book it was, cover to cover, and went home, put it into practice, and experienced maybe 40% improvement. And that it wasn't because of what I told him, except that I did give him a little bit of direction at the start, but he kind of took it from there. Now I will say, and I think it's important to say this, that again, that the more fine-tuned that a person's system becomes, the more sensitive he becomes. So pretty much everybody's going to reach a plateau at some point. And I say that just so that people won't get discouraged and think, oh, this dietary stuff, it doesn't work. No, it's just that you've hit a plateau, and you need to do you need to do the next thing. Because you never arrive. There's always something more that you can do.
I think arriving means you died. That's the only arriving we have in our world.
Right. That's what a person's looking for.
Well, and I find that in our office too. When a patient hits a plateau of any kind, we look at a new tool. We do a new thing, that whatever got them to this point is great and it'll maintain them, but it won't get them to that next place where they actually want to go. So having the coaching there, obviously both of us coach like crazy to our patients all day, every day. And it makes a huge difference in their life because then they do have a buy-in. So that's the difference between what you're doing and what medication does, right? To get full circle to what we talked about before. When you have medication, you're just popping a pill. There's no pain points there. There's no expense. There's no value really seen in the medication. You're just doing it. You're just going through the motions. There's no real buy-in to your health when you're taking medication. But there's a huge buy-in when you're changing what you're eating, making different choices at the restaurants with your friends, when you're making sure you're exercising. Holy cow, who does that? But, we've known for a long time, movement's kind of important, and so when you have a buy-in like that, you're much more likely to continue making good choices because you have that buy-in. And that's something medication just can't give us.
You're right.
Yeah. So I love that you do that. That is so cool. So is there anything else you want to add? Because I know people are going to be dying to contact you. So we need to know how they can reach you. Do you do phone consultations? Like, how can people get a hold of you? Because there's going to be people all over the country seeing this, and we don't want to limit them just to the Denver people. So how can they reach you?
The easiest way is just to go to my website, greathealth365.com. You can call us, email us, etc. And yeah, I speak with patients. I do a 15-minute or longer sometimes telephone consultation that's free of charge, just to find out if it's going to be a good fit and give people an idea of what they can expect and maybe what some of the strategies will be, etc.
That is awesome. And that's super generous of you and your time to do that. I also, I just think it's so important when you take a minute, answers people's questions, give them hope. Like you said, tell them there's actually a solution to this. They don't have to be on whatever drugs they've been put on. I've got teenagers that have been put on drugs and they've just been told, yeah, that's it. Rest of your life. That's a thing. And it's so sad. And it's from the toxins in their environment and the things they're doing to themselves. And, it can all change and it's a choice they can make, and you empowering them is so powerful. So thank you, Dr. Cunningham, for everything that you do and all the people that you help. So, yep, absolutely. And so please reach out to Dr. Cunningham and, go to his website. It's greathealth365.com. It's an amazing place to go. You can get the information. You can reach out to him. His wife is also absolutely delightful, so you could chat with her on the phone too. But the two of them work incredibly together, a super strong team for you and your life and your future. So get involved and get better.